Good afternoon, South Carolina. I'm Tammy Newman, the Director of Communications and Public Relations for your South Carolina High School League. Thank you for joining us for our COVID safety protocol presentation and Q&A. Questions were submitted by member schools prior to this, and we may receive some during this presentation. Now I'd like to introduce you to some of our Department of Health and Environmental Control officials, as well as South Carolina High School League's leader. First, we have Dr. Edward Simmer. He is the director of the South Carolina Department of Health and Environmental Control, appointed to this position and assumed duties on February 4th, 2021. We also have Dr. Brandon Traxler, who currently serves as the Director of Public Health for Dhak. She provides strategic direction for public health, leading its more than 2,000 employees. She ensures the delivery of appropriate, timely, and quality services at Dhak's 74 public health service sites located in every county of the state. We also have Myra Rees. She serves as the Director of Environmental Affairs for Dhak, overseeing the bureaus of air quality, water, land and waste management, environmental health services, and the Office of Ocean and Coastal Resource Management. And representing Dhak as well is Fran Marshall, a scientist and lawyer with 30 years experience in public health in both the private sector and in state government. Her experience centers in law, industrial hygiene, environmental toxicology, process safety management, emergency planning, risk communication, as well as with regulatory reviews anticipating the impact of proposed regulations. And representing the South Carolina High School League is Mr. Jerome Singleton. He will now give you a welcome and provide guidance for the rest of the presentation. Thank you, and please be sure to share the information with your friends and family.
Great. Thanks, Tammy. Good afternoon. I appreciate everybody that has joined us. This has been a challenging time for us, and we are so thankful and appreciative of Dhak for being willing to participate in helping us to navigate our process on how we need to move through our sports season with safety protocol as it relates to athletic competition. As time has passed, conditions have changed, new challenges are before us. We just want to get the information straight and truly understanding where it comes from one area, get the same voice going across. You will have many questions. They'll answer those questions, and we're just so appreciative of having them here. We'll allow them to share this information with us. As Ms. Newman has introduced them, you'll see that those that are experts in the field that we're working in. So we're really appreciative to have them here. And at this time, I'll turn it over to Dr. Simmer so that you can begin. Thank you.
Commissioner Singleton, thank you very much for that great introduction. I appreciate it. And thank you for having us here. We are very grateful for the opportunity to be with all of the many coaches and other school administrators who are on the line today. We know the last year to 18 months has been incredibly challenging for all of you as you've tried to navigate this terrible disease called COVID-19, and really tried to help the students and their families who look up to you and who you lead. So thank you. There's been a lot of misinformation out there about COVID, a lot of competing information. So the opportunity to come to you with what we believe is accurate information based on science, based on research, is very important to us. And certainly welcome your questions. That's why we're here. So please, if you haven't had a chance to submit a question yet, but would like to, please do. We work very closely with the Department of Education, the State Department of Education, with school districts, superintendents, school boards, and of course, individual principals and coaches to help navigate through the COVID-19 and the impact it's having on our schools. Our goal is to make sure that every South Carolinian, and especially our children, have healthy communities where they can live, work, learn, and play, and that they can thrive in a safe environment where they're as protected as they possibly can be from COVID-19. We also recognize, of course, there's more to health than healthcare. There is health involves everything from having healthy food to eat to a safe place to live. All those things impact on our health. And of course, right now, being with others, especially for children, having a chance to socialize, be with others is incredibly important. And our sports and our extracurricular activities that schools and other groups provide are a critical part of that. Those are critical components to supporting the current and future health of our communities. They also are very important to helping our children develop and grow and become leaders and become ready to become adults. So, we are very committed to working with all of you to ensure that our children can be in school, because we know children do better when they're in school. When we had no choice but to use the virtual environment in the past, and unfortunately, some schools are at that point right now, that's more challenging for a lot of our kids and their families. And they tend not to do as well when they're in a virtual environment, which is why we're doing everything possible to keep kids in school, keep them able to participate in sports and other extracurricular activities so that the great benefits that they and we get from those can be realized. On the other hand, we're also very focused on keeping children safe. And there have been a lot of very serious concerns about the spread of COVID in our schools. The version of COVID that we had a year ago, 18 months ago, very different from the version we have now. Now we have the Delta variant, something in the neighborhood of 97% of all the cases in South Carolina are now Delta variant. So when you see a case of COVID, you can almost certainly assume that that is a Delta variant case. And Delta is a little bit of a different thing than the prior types of COVID that we've had to deal with. They've all bad, but Delta is much more easily transmitted to children. Children catch Delta much more easily, and they spread it to others much more easily than previous versions of the COVID virus. So that when we are, looking at guidance that might have been put out a year ago, we have to look at those and modify some of that, because we're in a very different situation right now in fighting a somewhat different virus that has different risks and can do more damage to our children than we saw perhaps a year ago. We're also seeing a great surge right now, and you probably know that. Unfortunately, we just found out today that South Carolina is now the #1 state in terms of the number of cases of COVID per capita. In other words, as a percentage of the population, that is certainly not somewhere we want to be #1. We are now averaging well over 5,000 cases a day. And if you look over the past week, more than 7,000 of those cases have been in children under the age of 19. And especially under the age of even 10, which is something we had not seen before. Right now, children aged 11 to 20 are our highest group in terms of new cases. And just to give you a comparison, if you look back to the week of June 12th of 2021, we had 173 cases in our 11 to 20-year-old group, the group many of you are working with in coaching. This past week, as I said, that number was 7,713. That is just a dramatic increase. And that's more than the number of cases we're seeing in those who are much older. In fact, if you look at the group age 61 to 80, that's 3 times as many as that group had. Now, one of the reasons for that, of course, is that those who are older are much more likely to be vaccinated. Obviously, we now have the Pfizer vaccine that children 12 and over can get. We have been seeing somewhat of an increase in the vaccination rate in that population, which is good, but we need to see much more. Right now, about 23% of our children aged 12 to 19 are fully vaccinated, which means they've had both of the Pfizer shots, or if they're old enough, they had the Moderna or the Janssen shot. But that means that 70-some% are not, and about 32% total have gotten one shot. So we need to make sure that that gap between the 23 and the 32, that those kids get that second shot. But we do need to do a better job of getting those children who are eligible for the vaccine vaccinated, because there is no doubt that vaccines is the #1 way to combat and defeat COVID-19. There is, that is the #1 way that COVID is stopped. If you look at those who are vaccinated, yes, we do have some breakthrough cases. That is certainly true. But the number of breakthrough cases is very small compared to the cases in those who are unvaccinated. Approximately 90% or more of our cases are in unvaccinated individuals. And that's true for children as well as adults. And we also know that right now, every child in the state who is hospitalized for COVID is unvaccinated. Now, many of them are too young, right? If you're under 12, there's nothing that we can do. We can't vaccinate you yet because we don't have an approved vaccine. But clearly, for those who are eligible for the vaccine, if you as a coach, you as an administrator, can encourage their parents to get that child vaccinated, that's a great way to protect that child, to make sure that child can be an active member of the team, and that hopefully you won't lose them. The other thing is, of course, since we do have a relatively low rate of vaccination in those under the age of 20, and those under 12 can't get vaccinated, we need to do other things to protect them than only the vaccine. So we need to make sure that they are taking appropriate precautions. That means wearing masks anytime they're in a school building, or ideally anytime they're in any building when they're inside around other people, because people can transmit the disease even though they don't have any outward symptoms. We know that even for those who get symptoms, it can be 48, even for sometimes 72 hours before they show symptoms. But during that 48 hours, they're still spreading the disease. So the fact that somebody looks healthy doesn't mean that they are safe. That's why we require quarantine. That for those who are exposed, in a school setting, and are not vaccinated, we require that they be quarantined because we don't know if they're spreading or not. And generally, the quarantine is going to be 14 days. There are some cases where that can be shortened, and I'll let Dr. Traxler talk a little bit more about that. But that means they're out of school. That means they're not getting the benefit of being in school settings, which we've already discussed is very important. That means if they're on extracurricular activities, they're on a football team, they can't participate in that. And of course, their contacts may have to be quarantined as well. And you can see, and we've seen, a number of sports teams and entire schools, for that matter, where that has very quickly exploded out of control. And that's why we have several school districts right now that are entirely virtual. Why we've had any number of sports teams have to temporarily basically shut down because all their members were quarantined. And that's why we need to focus on some of the other protective things too. The number one of which is wearing masks. We recommend that every person in the school setting, students, teachers, visitors, coaches, everyone in the school setting, when you are indoors, you should be wearing a mask. It is in fact our recommendation that masks be required in schools. Obviously, there's some legal questions with that. The Supreme Court's looking at that. We're waiting for their decision. But certainly our recommendation is that schools should require masks. And we're actually going to be, and that is in our guidance for schools. We're going to be putting some more specific guidance for schools out here in the next day or so about, masking requirements and also when it's appropriate to go to virtual education because things are so out of control. So we're going to try to give you as much guidance as we can, as much guidance as the science supports, to help you make these decisions, which we know are incredibly difficult, incredibly controversial, because we want you to be able to make the right decisions, have the information to do that, and also then be able to explain to parents and others why you're making these decisions, because we know they can get very upset and that can put you in a very difficult position. So let's talk a little bit more about, where we go from here. Our number one focus is on getting folks vaccinated. We will be having vaccination mobile units going out into communities here in the very near future. We're not, no one's going to be required, at least not by us, to get vaccinated. I know a number of companies are requiring people to get vaccinated, and that's certainly between the employer and that individual. But, we do want to make sure vaccines are as easy as possible to get. We've worked with a number of school districts to set up vaccine clinics in the school. And we would be happy to continue to do that. Certainly, if you're a school administrator and you would like us to set up a vaccination clinic in your school or that supports your school nearby, talk to us, call us, go to our website and there's a place there you can click to reach out to us, and we will set that clinic up for you. We will get you that support because we know how important that is. And we know that there are parts of our state that are very rural and where, a lot of folks don't have good transportation, don't have good internet. So we will help you reach out to folks and make sure they know that mobile unit is available and that vaccines are available in their community and how they can get them. Our board, I actually report to a board. I don't report directly to an elected official. We have an 8-member board at Dhak. Our board has recommended that the legislature overturn the proviso that says that K through 12 schools should not require masks. As I mentioned before, that's with the Supreme Court. But certainly, if we do get to the point where you can do that, it is our recommendation that you do require masks in your communities. And I'm repeating that because I think it's very important. I think other than vaccinations, that's the #1 way to prevent the spread of infection of COVID in schools. And, other things that can help include things like social distancing to the degree you can. And I realize in a school setting that can be difficult. Obviously, appropriate cleaning, making sure, and doing some things that when children have to have masks off. For example, when they're eating, obviously no one expects a child to wear a mask while they're eating, but then let's see if we can do that outdoors when weather permits, because the risk of spread in an outdoor environment where there's, airflow and such is much less than the risk of spread in an indoor environment. So to the degree you can move children out of doors to do things that might put them at some risk, the better. So again, we greatly appreciate the work you're doing. We know you're in an incredibly difficult situation right now. You have parents, I get numerous calls and emails from parents demanding that we order masks in schools. And I also get likewise, although somewhat less, I do get emails and calls from parents who say, don't you dare. And we know, I'm sure that whatever I'm hearing and receiving, you're probably receiving much more of those than I am. So understand that we realize that you're in a difficult situation. We want to support you. We want to give you the information and the evidence so you can make the best possible decisions for all of those who are in your care, your students, but also your staff, and specifically then to the coaches out there. We want to make sure that our student athletes are protected from the disease, but that they also have an opportunity to participate in their sports or band or whatever it is that their extracurricular activities are, so that we don't lose the benefits. And that, we've already lost almost a whole year. So let's keep our kids in school. Let's give parents the choice to send their children to a safe school by requiring masks in schools. Let's encourage vaccination to the greatest degree we can for all of our personnel, both faculty and students who are eligible. And, working together, we will defeat this terrible disease. We will be able to move forward. I'm convinced of that. We're in a really tough spot right now. We've got a lot of work to do, but we are here to support you. After this is, this support does not end with the end of this teleconference, this video conference. We want to be a resource for you. So call us, email us, reach out to us. We want to hear from you, and we will get you the best answers we possibly can based on science. And we will support you as we go through this journey together, to keep the people of South Carolina safe and especially our children safe. So with that, again, happy to take questions. But let me turn things over now to our outstanding public health officer for the state of South Carolina, Dr. Brandon Traxler.
Thank you, Dr. Simmer, and good afternoon, everyone. It is wonderful to be back with the South Carolina High School League, though I'm sorry that, again, for the second year in a row, the topic is COVID-19. These numbers that Dr. Simmer mentioned really are eye-opening. As of Monday, also, data from our network of children's hospitals in the state showed that there were 35 children who were hospitalized at that point in time due to COVID-19. Excuse me, and of those 35, 34 of them were unvaccinated. If we want to continue to have sports and games safely and attend those sports and games and keep our children in schools, there is no substitute, as Dr. Simmer mentioned, for getting vaccinated when eligible. It is the #1 way we can ensure the safety of our players and you coaches, as well as those around us at the younger levels, both on the fields and at home, who aren't eligible yet because they're too young for the vaccines. We have to protect our children, especially those 11 and under who aren't eligible for the vaccine yet, because as Dr. Simmer said, it's that age group that's seen the highest percentage rise in cases statewide recently. Just this week in Richland, Lexington, and Kershaw counties, they reported more elementary school students, almost 500, have tested positive for COVID-19 than middle or high school students. That's the age, those elementary school, where none of them are eligible for vaccination. We want to fill up our stadiums and gyms, but not our hospitals and certainly not our homes with sick children or sick parents. The surge in cases that's affected our state's hospital system has stretched our 4 children's hospitals as well. They were reporting on Monday that their total bed occupancy is between 71 and 96% full. and that their pediatric ICUs for children were between 67 and 100% full. The numbers of schools that we're seeing who are needing to go virtual, the number of games postponed or rescheduled, and the thousands of students that some districts are reporting as being in quarantine protocols is alarming this early in the year. And it reflects those levels of disease spread that we're seeing in the communities. Just yesterday, Horry County Schools announced that there were 6,800 students in quarantine. Thousands more are in quarantine across the state, unable to attend class or participate in sports or other activities that are so important to a child's growth and development, as well as their educational experience. But this quarantine, as Dr. Simmer noted, is critically necessary for stopping the spread, especially of this very highly contagious Delta variant of the COVID-19 virus. And that Delta variant's accounting these days for more than 99% of the cases in our state. The only way to stop that and to get back to normal is for our communities and schools to make a total commitment to vaccinations, along with measures that we know help prevent the spread of the virus that are easy to do, like responsible social distancing and wearing masks when indoors around people outside our households. We recognize that the state law has prevented the school districts from enacting mask requirements, but that doesn't change our guidance or belief that all students, teachers, staff, and visitors should wear masks when indoors at schools. We're at a moment where no one wanted to be. I know that. None of us wanted to be here, especially a year later. We're facing some of the worst numbers yet of this pandemic, and the only ones that can stop it are all of us. The people on this call, you're leaders in your local communities, and often the voices people, especially those teenagers that need to get vaccinated, trust the most. And so we need your help to protect our children in a way we've never had to ask for in our lifetimes, and I hope never have to ask for again. Vaccinations are the definitive way out of this pandemic, and the universal wearing of masks indoors in schools is the best way in the meantime to protect those thousands of children who aren't eligible to get vaccinated yet. We've already lost more than 10,000 South Carolinians to this disease. That's enough people, if you think about it, to completely pack a high school football stadium. We're lucky to have leaders like you all, the ones on this call, and by pulling together as a team, Team South Carolina, we can achieve this ultimate victory, the ultimate win possible. It's defeating COVID-19 and saving countless lives. So thank you so much for having us, and best of luck to everyone this school year. Thank you for everything you do in our communities, and really for everything you do for our children, both on the field and off as mentors. I want to now introduce Fran Marshall, who is with our Environmental Affairs section, Deputy Area at Dhak. Thank you.
Hi, good afternoon, everybody. I'm going to keep my remarks short because I know most of your questions are going to be related to some of the information that you've just heard, and it's hard. They're hard acts to follow, our doctors, especially our leaders. One thing you've heard for sure, outdoors is better than indoors. I'm just going to cover a few other ways we can protect ourselves from this virus. We've talked about the importance of vaccines and masks. The biggest difference between now and the last time we spoke with y'all is the availability of vaccines for most of the population down to the ages of 12. Masks are important, you've heard that. So additionally, I just wanted to mention there are some other things we can do. We can administratively stagger people going into weight rooms or indoor spaces or locker rooms, or minimize the use of locker rooms. There are ventilation guidelines from the CDC, as well as this American Society of Heating and Refrigerating and Air Conditioning Engineers, or ASHRAE. So those things are important to make sure your ventilation is good. Some people are using barriers, and you just have to be careful with the barriers that you're not disrupting the flow of air or the removal of air from your spaces. Making sure that you have enough air changes per hour, high percent of outdoor air. Your mechanical folks, your HVAC, either contractors or maintenance folks, will know, probably already are aware of these guidelines and will be working with you on that, but it's something to definitely point out to them if they are not aware, just to make sure they are aware. There are some CDC guidance documents on ventilation, specifically in schools. There's an ASHRAE document for school ventilation. And I'm going to end there and get to the most important part of this, and that's your questions. So Myra, I'm going to turn it over to you.
Okay, thank you, Fran. Thank you, Dr. Traxler, Dr. Simmer, and all of you that have joined us for this conversation. And as Fran mentioned, this is probably what we feel like is the best part of these types of gatherings, is getting your specific questions answered. And I do want to reiterate Dr. Traxler's comments that we just so much appreciate this organization and everything that you do, the leadership role that y'all play in your communities across the state, including your commitment to reducing COVID cases, at the same time trying to support South Carolina's high school student athletes, who are really our next generation of leaders that are so important. The work that you do in your environment and the support of our next generation student leaders is so important. So we've got quite a few questions that are starting to come in, and I'm going to direct the questions to certain panel members. And then panelists, feel free to add to it if you'd like to add some comments. So the first question, and I believe I'll send this one to Dr. Traxler. This is a specific question, just a scenario. Say if Johnny tests positive and he's the team manager, does the entire team get quarantined for 10 to 14 days? And what kind of feedback can you give to folks with a specific scenario with that?
Sure. So that's a challenging one, where the person who's infected is the team manager, because he is probably interacting with everybody, with a larger number of people than many people on the team would be. And so what I would say is, for folks like that, not unlike you coaches yourselves, he needs to be aware, first of all, that he really needs to be extra careful with his distance and to be wearing a mask, because he is in contact with everyone. Specifically, with DHEC's help, with our help of our case investigators, you would want to trace back during his contagious period, what we call his infectious period, and determine, to the best he can remember, who all he was around and for how long and at what distance. And so, if that involved sitting on a bench between two people that he knows for a whole quarter of a game he sat between, then those folks are going to need to quarantine unless they're fully vaccinated. And this is where vaccination can play such a big role in how much time some of these teenagers have to miss from sporting events, is that if they're fully vaccinated, they don't have to quarantine. They can still attend school, and their sporting events are extracurriculars. So that's the big thing. Most kids, the vast majority of ones who are going to be eligible for high school league sports, those 7th graders and up, are going to be eligible for vaccination. And so really letting them know that could mean the difference between missing a couple of games versus being able to keep going if they're vaccinated.
And to add a little bit to that, Dr. Traxler, just sharing your thoughts on best practices to ensure safety as to bus trips, group transportation to sporting events, teams and fans. What kind of advice could you give the schools on those?
Sure. And so for fans, I would say that it may not be best for the environment. So Myra, earmuffs. But maybe try to take a little, maybe not carpool quite as much if you're all from different households. If you are going to, and it's a longer trip, more than 15 minutes, more than just nearby, then I would really recommend that, again, you're riding with vaccinated folks and that you wear masks. And so when you have students on those buses, again, vaccination can play a big role. Also, they need to be wearing a mask, and that's actually federal law from the CDC's order is still in place that on school buses, which would count for this, that they need to be wearing masks, everybody on the bus. The other thing would be to try to have, if you're going to away games a couple of times a week, have the same seating arrangement. It's easier for contact tracing and if you do need to do that. And I think Fran had her hand up. She might have some more info too.
I just wanted to add, in a car, make sure you turn the recycle air button off. My car in particular, I noticed it comes on automatically. So every time I get in it, I have to punch it off. And also on buses, especially as the weather cools down, open the windows. The more air you have flowing through, the better. You're reducing your risk, you're reducing your opportunity.
And if it's not raining, the vents.
Yes,
Up
definitely.
top.
Very good.
Thank you. So Dr. Simmer, you mentioned in your opening remarks about some new guidance that we're getting ready to release. Can you give any more kind of a heads up, a little bit more detail to the folks on the call today?
Thank you for the question. So, we've had a number of requests from school districts and superintendents, as well as our own board, to give some guidance on when a school should require masking and also when they should consider going to virtual because things are getting that badly out of control. So, I think right now, most of our school districts are going to meet the criteria for masking, but we are going to be publishing, hopefully tomorrow, our recommendations based on the science when schools should require masks and also when schools should consider going to virtual status. Now obviously every situation is different. We're happy to consult with school districts on a case-by-case basis if you have questions or would like some more advice. But you will be seeing that on our website again, I hope tomorrow. Dr. Traxler, I hope I'm not over-promising here. But, and I think what you'll see is that we'll give you some specific criteria in terms of, how many students are in quarantine, how many are positive, and staff too, not just students, that can help guide some of those decisions moving forward.
Thank you, Dr. Simmer. Dr. Traxler, there appears to be, a lot of questions about the booster shot. There's questions, about does the booster target the Delta variant? Can you talk a little bit about that?
Sure. So right now, I would tell you that the booster shot is not going to be different formulation than the first two shots, at least for the mRNA vaccines. However, the mRNA vaccines and Janssen, the Johnson & Johnson, but at this point we're looking at boosters for the mRNA, the Pfizer and the Moderna. They are very effective still against Delta. So we are still seeing very high percentages of cases that are occurring being among unvaccinated people. And we're seeing that these vaccines, not only are they safe, but they're very effective at preventing severe disease, which is that hospitalization and death. And of course, avoiding death is the ultimate goal with this vaccine and all vaccines.
Thank you, Dr. Traxler. Dr. Simmer, going back to you, the audience definitely appreciates the guidance that's coming out from the agency. And folks are, asking questions, if Dhak has considered, recommendations such as individuals that test positive or display symptoms of COVID-19 isolating for a period of 10 days and must be symptom-free for 24 hours before returning to school. Recommendation like classrooms that reach a positivity rate of 20% over the course of 14 days, shutting down for a period of 10 days. Just different scenarios about the positivity rate within the schools and the amount of time that the school should shut down. Any feedback on that?
Yes, and I'll certainly invite my colleagues to jump in here too. But yes, I think you will find that, the recommendations based on the positivity rate, both for a classroom and for a school or school district as a whole, will be part of what we'll be releasing. I think with regard to the individual student in quarantine, the first part of the question, that's already in our school guidance. In general, we recommend that close contacts quarantine for 14 days. There are some ways that can be shortened in some cases with a negative test and some other things. But, in general, we recommend quarantine for 14 days for a close contact. Again, as I said at the outset, we know that takes the student out of class, out of activities. That's certainly bad for the student. And at the same time, we have to balance that with the need to protect everyone else in the classroom and in the school, which is why we make that recommendation. And clearly, if we can reduce the need for quarantine, we would like to do that. That's good for everyone. But right now, the guidelines that we have, which are consistent with what the CDC has too, I would note, really are designed and we think are based on the science, are the best way to protect students, reduce the risk of spread in that school setting, and then hopefully, once that quarantine is done, get that student back to school and back in the full academic environment. But I'll certainly ask Dr. Traxler or Ms. Marshall if they have anything they want to add.
I think the only thing is if you do test positive, then that isolation requirement that they had mentioned is what we are is in our guidance and what the CDC recommends to the 10 days from either symptom onset or if they never had symptoms from when they were tested, and at least 24 hours fever-free, symptoms resolved or resolving, close to being resolved. So thanks.
Dr. Traxler, can you spend a little bit more time? I think the schools are all looking for a little bit more information about ways to really shorten that quarantine period. So if you could go into a little bit more detail about that. And then I think there's some questions about if students are vaccinated, do they need to be quarantined under certain circumstances and not under others?
Sure. So if you are vaccinated, you do not have to quarantine. Obviously, if you develop symptoms during any time, you need to self-isolate and go get tested. But so I would say that even vaccinated, everybody in this day and age needs to be a heightened level of awareness of symptoms, but they don't have to quarantine if they are fully vaccinated. And in regards to the options for shortening quarantine, absolutely. There really are two beyond to take it down from that 14 days that Dr. Simmer mentioned as the gold standard. And so, we want to keep kids safe. We also want to keep them in school as we can do it safely. And so with the CDC provides two options that we concur with to decrease then the quarantine. And in both of these, obviously the child or staff member needs to not have symptoms. If they can, you can decrease it down to 10 days if they don't want to get tested or aren't going to get tested. And again, this is for non-fully vaccinated people. Or you can go down to even 7 days, but with 7 days, they need to have been tested on day 5 or later, not before day 5 of their quarantine. And if they're negative on that test, they can come out on day 7. I will say it is also important, though, to the extent possible, at least when they're on the bench and in the classrooms and all, they need to have a mask on for the remainder of that to finish out the 14 days, even if they come back earlier.
Thank you. Fran, I know that the High School League really appreciated the feedback that you gave over the last year and a half with best practices, highlighting best practices that were specific for different types of sports. What would you offer up to the folks that are listening today? Any additional best practices as far as where we are with fall sports?
Well, I think some additional ones that we had in place last year are probably still applicable to this year. And that was, working in smaller groups. So you're minimizing the number of people any individuals coming in contact with when that's possible. We've learned a lot about the virus over the course of the year as well. And last year we were concerned about more than one person touching a ball and things like that we're not as concerned about now. But, certainly minimizing the number of people. And especially with indoor spaces, weight rooms and locker rooms are a concern to me because of the level of activity and that, under normal circumstances, each one would have. So you may want to consider staggering, having a handful of people in the locker room and the weight room at the same time and having the same people work out together or be sent to the locker room together so that they're exposed to the same people. And that way, if you have somebody who turns up positive, you have a fewer number of people, hopefully, that have to be out of the picture for a little while for sports and or school. Ventilation is key. I know a lot of schools are using ventilation to kind of evacuate spaces if they can, alternate the spaces that people are using, so the air conditioner has a chance to pull out the bad air and replace it with good air. That's not always an option, but sometimes it can be. Same as with cafeterias, same as the locker rooms. And I like the idea Dr. Simmer proposed of eating outdoors when it's a pretty day. So anything we can do to get better ventilation, fewer people we're around. And Brandon was apologizing for the energy efficiency or the environmental issue before. Most things that were designed to be energy efficient are bad for COVID, because energy efficiency is cutting down on the use of air conditioning when spaces aren't occupied, for example. And we need the systems working to clean the air out, put fresh air in and take old air out, even when people are, instead of saving, it may cost a little more money, but it will be worth it because it'll save people from getting sick, hopefully.
Thank you, Fran. Dr. Simmer, would DHAC or does DHAC recommend limiting tickets to sporting events similar to last year?
I think that's somewhat community and venue specific, certainly in an indoor venue, very much so, yes. I think you have to be very careful if you're having like a basketball game in an indoor location. I think for outdoor events like soccer or football often are, I think some of the things we did last year still make sense. For example, having family pods, selling a group of tickets together to a family that lives together makes a lot of sense. And if they are living together, they don't need to socially distance because they're in contact all the time. I do think that keeping people distance, even in an outdoor setting, still is the best precaution. I think that, so limiting tickets to some degree, I think, yes, I think we would still recommend that. But again, I think that's much more important in an indoor setting. I know some venues across the state have required proof of vaccination or proof of a negative test. That is certainly one way to do it. It's labor intensive. And I'll be the first to say there's fake ID, there's fake vaccination cards out there, unfortunately. You can buy them on eBay. But, I think that there are a number of ways that we can do this. I think limiting tickets is certainly one, and that is one that we would recommend you consider. Again, having families sit together, but then keeping the family groups separated may be a good way. For indoor events, I think there you really do need to limit ticket sales, keep people distanced, require mask wearing at an indoor event. We do recommend at an outdoor event where people are very closely packed, like a stadium, that everyone wear a mask. If there's good social distancing, I think that becomes somewhat less important. I think the other thing for the indoor events, is you really got to look at your ventilation and be thinking about that. And I'll let Fran talk some more about that because she's the expert. I know we need good ventilation. She can tell you what that means. I think, so limiting tickets is one way, but I think there's some other things you can do too, as we've discussed, that can also help reduce the risk, but still allow at least some people to be able to attend the events and cheer on your kids. So let me stop there and see what Dr. Traxler and Fran have to add.
I think you covered it from my standpoint, Fran.
I think you covered it well. The one thing I didn't mention before that I wanted to mention, I'll just go ahead and mention now, is with band instruments, they make the covers that go over the bells of like the trumpets and those kind of things. That helps protect the people in the next row. and
Yes.
So I think things like that are important as well.
And keep in mind the other thing I'll also mention, when I was in high school, I did play the tuba, and we did have a cover. I did have a cover on my tuba because we spelled out the mascot name. But it actually did catch a lot of stuff too. But the other thing I'll note is that one of the highest risk activities is singing. So if you do have in that, so I would recommend that if you do have, a sporting event with attendees, if you've got a group that usually sings, I would probably not have them right now. I would also be cautious with things like cheerleaders who are yelling and screaming. Again, that's going to increase the risk because when you're yelling and screaming, you're projecting the droplets that carry the virus. So I think those are the kinds of activities that you might want to particularly limit. even if you are having, some fans at the game, where the game may be somewhat safer than, again, some groups singing or shouting.
Great information. Thank all of you. Dr. Traxler, with a negative test, if a student returns on day 7, should the mask be worn while competing for the next few days or only while in common areas such as locker rooms, benches, etc.?
So if they can safely wear it while they're competing, I would encourage it. I'm trying to mentally run through lists of fall sports in particular, and which ones it might be feasible in versus others. It's going to be difficult, but I would say certainly as much as they can when they're going to be in close contact with other people, as much as they can safely, they should have one on.
Thank you. And also continuing, Dr. Traxler, bottom line, can you still transmit COVID if you're vaccinated?
Yes, you can. However, it is much less likely than if you're not vaccinated. I think we are at the latest numbers, I think high 80% of our cases that we were aware of from mid-July to mid-August were not fully vaccinated. So that gives you an idea. The vast, vast majority are not fully vaccinated.
Thank you. So, Dr. Simmer, if it makes a difference as far as transmission of COVID to be outside versus being inside, has there been any consideration given to differing the contact tracing requirements?
So I think, contact tracing is important regardless. But let me turn that over to Dr. Traxler and Fran to discuss if there's been any focus on whether we should vary that at all.
Sorry, struggling with my unmute button there. And so we're looking at which scenarios specifically again. I apologize. I was looking down in an email that had come in.
No, there's been I think folks are really understanding, the spread and certainly being outside is much better than being inside in close vicinity. Has there, and I think just the whole contact tracing and quarantines is such a concern. Has there been any consideration given to differing those requirements for inside versus outside scenarios?
And so I know that this is something that the CDC, for example, has been looking at, and they're still encouraging that to use that 6-foot rule, for indoor versus outdoor. And so we are certainly watching with them in terms of if there is data that they get that would show that you could change it up for outdoors versus indoors. But they still are recommending that 6 feet for being a close contact and outdoors. But we do know that outdoors overall, just in general, is much better than indoors, much safer.
So let me continue with another question, kind of getting out of that arena a little bit. But I think folks have been obviously reading the guidance, and which is, I think it again is extremely valuable. One of our listeners is asking the question, what is the reasoning behind the differing standards for staff to student contact tracing and student to student contact tracing?
Sure. And so that is a great question, because there's that 3 to 6 feet if they're wearing masks. For students, they're not a close contact, but if it's one of them or is a staff, then they still are. And that is because based on last year's data, students were not transmitting it much. And this is data from worldwide. We were seeing very little, child to child transmission, particularly if they could be at least 3 feet or so apart. With Delta this year, it is a game changer. It's so much more contagious, including among kids. However, still in general, there is a little bit less of a risk of transmission from child to child than if you have an adult in one of those scenarios. Plus, the older you get, the higher risk you are from maybe more severe illness, particularly if you're not fully vaccinated. But I do know the CDC is also keeping an eye on that in light of Delta in schools this year to see if they need to make any adjustments.
Thank you. Fran, I know data always gets your attention. Is there any data to suggest that 6 feet is more effective than 3 feet other than an increase in cases when you're talking about social distancing?
I think an increase in cases is enough. So 6 feet is better than 3 feet for sure. And I'll let, if Dr. Traxler or Dr. Simmer have anything to add.
So,
Go
go
ahead,
ahead, Dr.
Brent.
Simmer. No, go ahead.
I was just going to say that I didn't have anything to add. I think that's good, but Diane, please.
Nope, same thing. Fran got it.
All right, fantastic. All right, I'm going to go back and look and see. Let me just pose one question. I think we got a couple more coming in. I think folks are noticing some of these home test kits, Dr. Traxler. Can you talk a little bit about that, about the confidence, and just that test?
Sure, and I will fully disclose that I have not seen the most recent numbers for all of these because there is more than one at-home test kit now. But in general, I don't want to say we trust them less, but there is a little bit more concern sometimes with the accuracy because of making sure that they are performed correctly. At least if they're being done in a healthcare setting or by a healthcare provider, we can take a little bit less of the human error factor out of the equation. And so that is one concern. There's also the concern about the rapid tests, just in general, administered by whomever, and their accuracy. In general, they're more accurate when somebody has symptoms versus when somebody does not. But there is a variety in terms of what's available, the different ones, and and what those that sensitivity and specificity is. So it's better than no testing, but I really encourage everyone who does it at home to make sure they read and follow the instructions very carefully. And certainly if you have symptoms and you test negative on an at-home one, please go get one of the ones that goes off to a lab, the PCR test.
Thank you. All right, so Dr. Simmer, I'll come back to you on this one.
Okay.
And I think folks are really appreciating and understand the importance of vaccinations. One of our listeners asked if you could get vaccinated if you had COVID earlier, but it hasn't been 90 days yet.
So no, we recommend, and I believe the labeling on the medication, also on the vaccine, also clearly says it should be at least 90 days. Reasons for that include the fact that will get you a better vaccine response, a better antibody response to the vaccine, if you wait that period of time. So we certainly do recommend that people who've had COVID get vaccinated if they haven't been. But I think waiting the 90-day period is very important.
Thank you. And Fran, I'll go back to you on this one, but any of the panel members feel free to add to it. Asking the question, have recommendations changed for public water sources, at sporting events like water fountains, during these outdoor sporting events?
Like I said earlier, we've learned a lot over the last year and a half. We know that COVID itself is not a foodborne illness, and we don't know that it's transmitted through water either. I think the best practice, though, still is probably to bring bottled water or buy bottled water, or to have the fountain set up to fill bottles instead of putting your face down in the fountain. I think that's probably the best practice, and that's just for any. When you touch stuff and then touch your face, that's when you're, that's something we're a little concerned about still. So, drinking out of a water fountain is hard unless it's handless or something like that. And even then, better to fill up a bottle than to put your face down over the dispenser, I think. Do y'all have anything to add?
I agree.
Yeah.
I get a little concerned about people kind of the spittle that might come out when they are going to drink out of a water fountain, and it still is probably low risk, but I agree with you. I think if nothing else, even just taking a bottle and refilling it rather than putting your mouth down, then it would be better.
I agree. And Myra, I just want to point out, I think we have some questions in the Q&A box too, as well as the chat. I don't know if you saw those, but I think there's a couple there we may not have addressed yet.
All right, I see one that just popped up, in fact. What symptoms should keep a student in isolation? For example, we had a student the past 10 days still had loss of taste and smell, but no other symptoms. Knowing that taste and smell can last for months, what specific symptoms should keep a student in isolation?
Want me to take it?
Yes,
Sure.
ma'am.
Fever. Certainly fever. Otherwise, they need to be improving, except I will say loss of taste and smell is that one that unfortunately for some people can linger for a while. I've heard one person told me up to a couple of months. I don't think it's that long for many people, but for most people, but in regards to shortness of breath or cough, congestion, as long as those things are showing, significant progress and improvement, I think that the wording that the CDC technically uses is symptoms are improved. So they don't say resolved, but they say improved, with the one exception again, that can't be having fever.
And Myra, if I could add there too, there will always be some of these cases that don't fit perfectly into our criteria. And that's when, you need to talk to the student's doctor, their pediatrician, whoever their provider is, get their advice. And also you can also reach out to us and ask about individual cases too. That's why we're available, but I'd also, being sure that the student is seeing a doctor, and I would talk with that individual to get their assessment.
Thank you, Dr. Simmer. And just to add, going back to the vaccinations, if someone gets the first shot and then they contract COVID-19 before the second, what needs to happen? Can you take that? Yeah, go
Sure.
ahead.
So they have first, I want to make sure I understand, they had first vaccine and then they get COVID-19. And then, so they need to wait at least, at a minimum, they need to wait until they're out of isolation. Please, nobody go get vaccinated while you're in isolation or quarantine. But again, I don't know if Dr. Simmer has seen, I have not seen guidance that says you need to wait up to 90 days. But you do need to wait those 10 days at least, and then make sure your fever's gone and other symptoms are improved. And of course, if you want to make sure it's been the right interval also for the vaccine. So 21 days for Pfizer, 28 days for Moderna.
And that's my understanding as well, is that if you have the first dose and this happens, of course, and then you get COVID, you can still get the second dose more or less on schedule. Again, so long as it's safe for you to go out and do that.
Thank you. Commissioner Singleton, I'm going to look to you to see if just the questions that you're receiving from folks across the state, if maybe there's a certain area we haven't touched on yet, or any questions that you may have.
Well, I think you've pretty much cleared it up. You've covered the areas of quarantining if somebody's tested positive and what's considered close contact and what's contact tracing. I think that pretty much clears up a lot of what they were asking about all year.
Okay, so I believe we're getting close to the end of our session. So I want to give the panelists just a real quick, just closing comment or message they'd like to leave folks with as we wrap up. So Fran, starting with you.
Sure. I just want to say, just remember, you're not in this alone. We are here. We work for you, the citizens of the state and the leaders of this sector, and we want to help any way we can. And I'll just say, based on my experience decades ago as a high school athlete, if my coach had asked me to jump off a bridge, I'd have done it. So you have a great responsibility and a great opportunity to affect the lives of the young folks, and we appreciate all that you do.
Thank you. Dr. Traxler?
I agree. The kids, the teenagers, we really need to get vaccinated, the ones that are eligible, and you guys are their mentors, and people that they look up to. And so please, first of all, for yourselves and your family and friends, get vaccinated, and also to set that example and encourage your students, your athletes, your student athletes to get factual information from accurate sources, because there's a lot of misinformation out there. Encourage them, support them in choosing to go get vaccinated, and then in wearing masks and taking precautions, because I know that I personally have missed sports, so I think we all have, and so this is the best way to get back to doing that safely.
Thank you. And Dr. Summer?
Thanks, Myra. First of all, great job moderating, so thank you for that. And especially a shout out to Commissioner Singleton. Thank you, sir, for having us, giving us this opportunity. As certainly Fran has said, and Brandon has said, we are here for you. We want to support you. We want to help you through this. I think there is a lot of misinformation out there. We all know that. So let's make sure that our kids and their parents are getting the right information, that we're giving them sources of information that are reliable so they can make good decisions for themselves and their families. I don't think any of us want to take the decision-making away from the parents and their families, but let's hope that they're making those decisions based on reliable information that is accurate. Again, as has been said, you have a major role in these children's lives, and I appreciate all the great work that you do. I know it's not easy. I know you have had some very difficult times, and there will be more difficult times to come, unfortunately, but together we'll get through this. We are going to defeat this terrible thing. And 3 years, 5 years from now, hopefully, we'll see these kids becoming leaders themselves, and that'll be thanks to all of your great work. So again, thank you for all that you do. Please reach out, call us, email us if you have any questions at all. We're available, and we look forward to working with you. So thanks again.
Back to you, Commissioner.
Thank you. Dhak staff, we really appreciate all that you've done. If you could hear the people that are clapping for you and applauding your effort, it would be resounding. I just want you to know that we really appreciate it, and it has really helped us. For our schools, lots of useful information, and they stated before, any unanswered question, please direct them to Dhak or your local health department. We want you to have a clear understanding of the recommendations that Dhak has. But remember, as they said before, the choice is still yours. The choice is still yours. You know your population. We appreciate your commitment to the student athletes, the coaches, and the staff, their safety. That is very much appreciated. But we ask that you continue the known effective safety protocol, the wearing of masks, the sanitizing of equipment and hard surfaces, the practicing social distancing. Those challenges are there. Earlier this year, I sent out a challenge to all of our schools, and we asked the student athletes. We issued a challenge to them. We want you to mask up when possible, avoid any unnecessary gathering. Wash your hands, sanitize the equipment, the hard surface, and other items as frequently as possible. Avoid the traditional celebrations, the high fives, the hugging, and everything that goes, and any unnecessary touching of your teammate and or opponent. And reclaim your social distance space. We ask the athletes to take that challenge and help us to navigate this virus. But we also issued that challenge to our administrators and our coaches. We ask them to not only follow those same advice, but to be leaders and role models and helping to encourage those to practice those safety habits, doing practice, doing school, doing the sporting event, and even encourage them when they're away from school to practice those. And that was a challenge we issued to our coaches and administrators. And we again ask you, please accept that challenge and take it on. But we didn't leave it just there. We went to the parents. We asked them to follow those same challenges that we asked them of the coaches and the athletes, but also mirror those being responsible to your child. Use the mask, use sanitation, and even limit the interaction that your child had with others that are outside the family or outside the home. But we were sure not to leave out those others that we feel are very important, our member schools, communities, and their neighborhoods. And we had that same challenge to stay ahead of the curve by supporting the medical community, to respect those professionals that are put in place to keep us safe and to follow the guidelines set forth by CDC, Dhak, and our local medical professionals. We want you to please accept that challenge. As we navigate sports competition this year, I ask that you continue to stay focused and intentional in keeping all involved health, safety, a priority. This has been great. We thank everybody that joined us, and we really appreciate the effort that you put forward and the information that we get from Dhak. With that, I'll turn it back over to Ms. Newman. Thank you.
Thank you, Commissioner Singleton. And a huge thank you to our officials from Dhak, Dr. Simmer, Dr. Traxler, Fran Marshall, and Myra Reese. Thank you so much for your time and effort and obvious passion to get our coaches and our communities and our student athletes on the right path forward. So thank you so much for all of the information. And for those watching, I can vouch for the Dhak officials that if you do have a question, please contact them. I'm going to go ahead and share their email one more time because I have actually made contact with them myself, and they do get back with you. So if you do have questions that weren't answered here today, just send them a question, send that question to them at info@dhak.sc.gov. Send your questions and someone will get back to you. And if you have questions for us, same thing, please visit our website at schsl.org and we will get back with you as soon as possible. Stay safe and do what is necessary to keep everyone around you safe. Again, thank you for joining us and we'll see you soon.